Gambian drivers are complaining of low income as state of public emergency orders them to carry passengers at half. Tunisian government has urged citizens to stay at home and respect measures to cope the deadly coronavirus pandemic. Zimbabwe's government has avoided lockdown of the country for now in the wake of global efforts to contain the spread of COVID-19 amid public outcry. This and more coming on The World Today. Hello, it is 1700 GMT here in our studios in Banjul. You are watching the New World Today News Bulletin on Africa TV. I am Amadou Kante and now the news in detail. Gambia's road traffic is beginning to experience some unusual characteristics following presidential state of public emergency. The announcement on Friday as part of measures to control the spread of COVID-19 response. In his second address of the nation, President Adama Barrow ordered drivers to cut down the number of passengers by half, but this move does not go down well with drivers, some of who are now confined to income only good enough to refund operational cost. Let's have more details of that in this report.
Following the invocation of powers vested on the President by the 1997 Constitution to declare a state of public emergency, the traffic has been manifesting some unusual characteristics, especially during the wee hours. In his second address to the nation, President Adama Barrow ordered drivers to cut down the number of passengers by half in efforts to combat the COVID-19 pandemic.
All public transport shall carry half of the total number of passengers they are allowed to transport by law.
Lamin Sane, a van driver, appealed to government to reduce the fuel prices to protect the income of drivers to be able to live up to expectation.
So you have 6 passengers, après moi 7. So gis na nit yi ñu bari yeneen driver dawuñ. So ñu ngi dimbal nit yi, ñu kay ñu ngay daw. Walo febo ñu so wacce da nga dem jëna gasoil yépp. Gasoil wañu. So lolu arrange ñu driver yi sax. So fay gasoil la fa wañi, ñu mun nañu liggé non.
Usman Kale, a taxi driver, expressed dissatisfaction with police in the aspect of enforcement procedure.
Dañ la wara téye nga ñu fayeeku la xaalis lu xam ne moom yow xam ne liggéeyaguloo ko suba teel rek ñu téyeegulam ne li la fayee ko xaalis boo xam ne moom noo bëri si non lan moo waral loolu suñu soo dee eb nga ñetti client te yow ñetti client lañ la waxoon yéen ñetti client ñaar si gannaaw benn si kanam léegi yow boo ebee ñetti client yi nga ñëw accès si police bi mu ne la yow wàccal client benn bi mu des ñaar client kenn si gannaaw kenn si kanam léegi si kaw loolu dañ la war a téye nga fay xaalis bala ñu la bàyyi at least ñu advice la ñu ne la yow ñetti client yi nga eb wàcca kenn gi nga dem.
In spite of a few commercial vehicles being on the routine business, dozens of commuters are left to wonder whether to spend beyond their daily transport budgets or remain stranded and forget about their important errands altogether.
And where I am right now, actually I may take a vehicle which I may pay $25 or $30 in order to reach Banjul, because I have to go to Banjul and go back up to Kunkuja Mariama. Yeah, it's not easy. It's difficult perhaps, because like most at times when I'm going to Banjul, the road is always empty. You can rush to Banjul, within an hour you come back. But looking at it today, it's critical.
But Permanent Secretary at Ministry of Transport Moduke Sise argued that the measures are only meant to respond to an emergency situation and not to serve as option for exploitation.
The measure encourage people to stay at home as much as possible. It is just, we just said, for those who have to do essential errand runs, then those are the ones who are permitted to go out. When they go out, then limit the load numbers of vehicles to about half. So ordinarily, with significant number of people staying at home, we didn't expect that kind of traffic now. Be as it may, it's happening and the traffic is high, but we are talking to GTSC to deploy additional services to ensure that this is contained.
The order to cut down passengers per vehicle came along with government's decision to cut down all official operations that will lead to the reduction in the number of workers in the public offices. Reporting for iAfrica TV News, I am Aminata Job.
And from the report there, next we head to Zimbabwe, where Zimbabweans have raised concern on the government plan to lock down cities amid the spread of coronavirus, saying shutting down all public businesses would not help. Health workers are also worried about their safety, with some withdrawing their services due to the lack of protective gears to address with the disease. But health authorities have promised to deliver needed equipment to all healthcare centers to improve the situation. Let's have more details of that in this report.
Borders have been closed for human traffic, public gatherings of more than 50 are prohibited, and schools, universities and bars have been shut down. But an all-out lockdown, which many believe would be hard to enforce, has been avoided for now.
Most of us are vendors, so if you're forced to stay at home, we will die of hunger. A lockdown won't work.
Even if the defiance was overcome and people stayed home, they would still lack a basic essential: water. Some residents in the capital have not had running water for years, and what they do get from community boreholes may not be adequate to keep the coronavirus at bay.
We used to be scared of cholera, but now there's coronavirus, which finds us in the same predicament. Not enough water to wash our hands frequently, and the water from this borehole is rusty and can affect our internal organs if we drink it.
Even those meant to be at the front line of fighting the outbreak are fearful due to a lack of protective equipment. Junior doctors have withdrawn their services until their safety is assured.
As we speak, Harare Central Hospital is closed. It's locked because all the nurses decided to go and stay safe at home because there was no plan. There was no plan as to where they are going to get face masks, etc.
But the country's main referral hospital, where safety and screening has been enhanced, remains functional. The health ministry says donations, including a consignment of equipment from Chinese philanthropist Jack Ma, are being urgently distributed across the country.
As soon as those personal protective equipment becomes available at the hospitals, and as soon as our safety as healthcare workers is guaranteed, we are ready to serve the Zimbabwean population.
The Zimbabwean government has begun inviting private players to refurbish idle hospitals to expand the country's capacity to deal with more infections.
From that report there in Zimbabwe, of course, next we come back home. And as you know, of course, we expect to hear from the Minister of Health to update Gambians on the current situation of the coronavirus, because on daily basis during the week, the minister expected to update Gambians on the situation. Now, we'll go back to Banjul and speak to our reporter on the ground, Ibrahim Abba, to tell us what is the latest on the, of course, briefing today. Thank you very much, Ibrahim, again for joining us. Now, we expected, of course, the minister was expected to update the media about 30 minutes ago. What is the latest as we speak?
Yeah, until now, the schedule stands by it. That is the press conference, which from daily update from the Ministry of Health and Social Welfare is going to go ahead. The good news is the minister with his technical team are all indoors right now, trying to put heads together, which is a usual way for them before every press conference. So already the media is here, and we hope that they will come out soon to update us for the public to know what exactly is the situation of coronavirus in Banjul.
Well, like I said, of course, the briefing should have started 30 minutes ago. Another delay, should this insinuate any sort of a new case again today?
Yeah, so every press conference could bring something new. That is the usual news for the Ministry of Health and Social Welfare. And the technical team will always tell us that before they speak to the media, they need to consult one another. The health facilities are far apart. They need to look into the daily report and come up with one voice. And that voice could always be another case or the same for number that is so far confirmed. But as it stands now, any news from the ministry or anytime they speak to the press is either there is a new case or they just reinforce the call for social distancing and other precautionary measures that the Ministry of Health is domesticating from the World Health Organization as to means to prevent the further spread of the coronavirus in the Gambia. As you know, we have 4 cases and it is easier to control the spread than fighting all over when the pandemic or the spread of the disease have gone further than 4.
There is still one probable case pending. What are we to expect today as we await to hear from the minister?
This will be the second time as test on coronavirus is subjected to another individual for a second time. You remember the second Bangladeshi who was tested initially and the lab technician said, screening report said positive, but confirmatory report said negative. And the second test was subjected to second test, which eventually said negative. So this is the same situation that is happening. Someone is tested and it is not clear, it's called probable, and it was inconclusive, and now the second test is awaited, which the minister said is improbable. So today's press conference will find out that the period for the waiting is over now, and we are either to be informed that it is positive or negative. So the Gambians are putting fingers across to see that the case that was probable for the past 24 hours will be negative today.
Our man on the ground, Ibrahim Abba, many thanks for the update. And of course, we hope to hook up with you sometime next time. But for now, thank you. Now, of course, we go back to what was reported yesterday on the situation of the coronavirus in the Gambia, because the number of people who contracted the contact of COVID-19 pandemic in the Gambia has increased with the confirmation of a 4th case patient on Sunday. Health Minister Dr. Lamin Samate said the new case is a Gambian in his 50s who arrived in the country on the same flight with the 4th case on March 15, with one probable case whose results is pending. For more details on that, we go with this report.
Gambia's COVID-19 pandemic situation has changed with the confirmation of the country's registration of a 4th case patient on Sunday. Health Minister Dr. Ahmed Samate announced the confirmation of the 4th case following a laboratory test on 23 people. He said there is still one probable case whose test results is inconclusive. He said the new case is a Gambian in his 50s who entered the country from France on the same flight with the 1st case patient.
The recently confirmed case, that is the 4th confirmed case in the Gambia, is a Gambian gentleman in his 50s who arrived in the country from France by Royal Air Maroc, flight number 8579 on the 15th of March 2020. He was in the same flight as the 1st case, even though they originally departed from different countries. His issue was reported to the Rapid Response Team through the National COVID-19 Hotline 1025, being operated by the Ministry of Health. A sample was collected from him and the positive test result came out on the night of the 28th March 2020.
Health Minister Samate said 16 of the close contacts of the 4th case has been placed under quarantine, while plans are on the way to have their samples collected for COVID-19 testing. The 1st case in the country is a female Gambian who entered the country from the United Kingdom, and the 2nd case is a Bangladesh man who entered the country from Senegal. He was confirmed to have contracted the virus after his death, while the 3rd case is a male Gambian from France. Mr. Samate said conclusively Gambia now has 4 confirmed cases of the global health-threatening disease that has been declared as pandemic by the World Health Organization, with one probable case.
For the probable case, We have a new probable case that has been reported as the laboratory results of one of the contacts recently came out inconclusive. So that is the probable case we are talking about. A repeat sample from the probable case will be taken and tested in a couple of days to conclusively determine whether it would be COVID-19 or not.
On Friday, President Adama Barrow declared a state of emergency in the country and ordered all government and private institutions to scale down their work. He also ordered for drivers to reduce the number of passengers to half and all places of workshop be closed with no gathering for more than 10 people.
To curtail our exposure to infection through close interactions, my government has taken the decisions to scale down government operations. Accordingly, all heads of government institutions, parastatals, private enterprises, and other institutions have been instructed to scale down their activities, with minimal staff to perform basic services. Where feasible, staff can work from home.
The government has earlier banned all public gatherings, closed the borders and airspace and announced $500 million COVID-19 emergency response, but its actions were criticized by many citizens, saying the government was late in taking decisions to protect the people. Reporting for iAfrica News, I am Absegei.
Well, thank you very much, Hafsa. And from that report, we will now take a break and come back shortly with the remaining of the stories. Stay with us. We'll be right back.
Assalamu alaikum wa rahmatullah wa barakatuhu. Bon nak doomi Gambia baax na ngeen xam ne feebar bi lu am la te lu graaw la. Ñun ñëpp xam nañ ne dégg nañ ko ci rajo yi dégg nañ ko ci TV bi soo demee mbitim réew fu mu nekk nii Italie Spain ay téeméeri nit ñooy dee ci benn bés bon nag du caaxaan bon nag nit ñi buñ ko caaxaanee nañ lu déglu suñ docteur yi lu ñu wax nañu ne buñ joxee loxo bon nag loolu yomb na buñ joxee loxo wax nañu ne ñu fagaru loo xam ne dafay indi yokk feebar bi ñu bañ koo def ñu ne ñu mbooloo baaxul buñ dem ci mbooloo suñ munee toog suñ kër ñu toog suñ kër am na démb rek maa ngi dégg ñuy wax ne waa lii caaxaan la ay chinois ay américain ñoo ko indi pour seen garab yi jar loolu yëpp caaxaan la su nekkee ne dañ feebar nañ leen déglu docteur yi ñoom ñu digal ñu lu ñu digal ñu def loolu bon nag koo xam ne yaakaar nga ne gis nga ay mandarga yoo xam ne yooyu la docteur yi wax mu ngi ci sa yaram bon nag loo war a def mooy nga call number booy call mooy 1025.
Mon kontaan boy mu ne boy nga ñim bata mu be taki tubabu du boy nga nakko do mu be do ku boy nga kina ñin kenni moy boy pour ay bu ngolo ñi boro na bu hani lento am futa ji boy de jibe lu njumala ya fuñe koy babul lola ama me ila bu ngo jibe abadane jara foy te lafta fula ñi mam balu kalam mu balu fo balu ko budlo ko fanan kele boy ñim bu ngo jala be ñamende abbe mu balu la do boy
ñin kunne soniyata ta www.baluwo.com anin baluwo isela bulloran jorangol be sang anila kudula asatare mambata jorangol membu ko cemento kenyo babarol nil peruol woni nga nyon jamal tabaluwo.com yin jorangol be sang ila dinkira bado adungite batala je anin baluwo ifangole marate la kudula.
Welcome back. You are watching the World Today News Bulletin on Africa TV, and now to the rest of the stories. Tunisia government has deployed the army on the state to deal with people who are not respecting the measures taken by government to contain the spread of COVID-19 pandemic. Health officials have warned that if the nation is not shut down, a lot of lives may be lost. Authorities say the measures are yielding positive results in helping the country to bring the situation under control. Let's have more details of that in this report.
Tunisian health authorities have warned that the country will suffer human losses if the general lockdown and quarantine measures are not fully respected. The head of state deployed the army in response to the failure to comply with these decisions, especially in regions that have recorded horizontal transmissions.
I understand the measures are necessary for health reasons, but I can't stay at home for the whole day. It's difficult to change one's habits.
Staying at home and respecting the lockdown and curfew is not out of fear, but rather a responsible behavior to stop the spread of the virus. I agree that our rights may be restricted for a short period of time to save lives.
The Ministry of Health noted that China's management of the coronavirus crisis is exemplary.
The epidemiological situation can improve if we follow China's strategy, where the number of infections and deaths is down and will certainly reach zero. China's example is reassuring.
The president of the Health Commission at the Tunisian Parliament also noted that many lessons could be learned from China's successful lockdown in some affected regions.
Chinese authorities closed a dozen makeshift hospitals in Wuhan. This proves that efforts to curb the virus are working when people respect the lockdown. This is a lesson for Tunisia and Africa, where governments do not have enough means to face the virus. China's success is also a lesson to the world.
The Ministry of Health has urged citizens to respect coronavirus general lockdown. Authorities say this behavior is not a procedure that limits freedom, but rather a necessary measure to protect public health. The director of the National Observatory of New and Emerging Diseases declared that it is still possible to redress the situation by respecting the general lockdown, the curfew, as well as all prevention measures. The official added that otherwise the consequences will be disastrous.
From the report there in Tunisia, next we head to Uganda, because Uganda's capital Kampala is in a 14-day partial lockdown as part of measures to stem down the transmissible deadly coronavirus pandemic. But it is now without the public noticing the impact on their daily business with limited public service transport. Well, commuters are urged to work as government hopes to control the spread of the virus. Let's have more of that in this report.
Kampala, capital city, is on partial lockdown. The country's public transport has been suspended. Local authorities believe this is the only way to reduce transmission of coronavirus. But the suspension is impacting heavily on people who commute to work daily. The government is encouraging people to work from home.
A motorcycle taxi is the easiest way to get money in this city. The new measures are affecting us.
I believe they're trying to give up precautions on a way how we can keep ourselves safe from contracting the disease.
My income has reduced. I have been earning about $12 a day, but now I can't even make $3.
Private cars are allowed to carry only 2 passengers, and those with bicycles can ride. Health workers are also encouraging people to wash their hands frequently with soap, stay at home, and also seek treatment if they are sick. Through these measures, the Uganda government hopes to reduce the spread of the novel coronavirus.
From that report there in Uganda, we will finally bring this news bulletin to an end. But for more on these stories and others, you can also log on our website on iafrica.tv. Many thanks for the pleasure of your company, of course, but you stick around. As you know, the minister is expected to update the country on the latest situation of the coronavirus in the Gambia. And Africa will bring you live happenings on the ground. But for now, thank you very much. Bye-bye.
alhamdulilah mbokk yi lii nga xam ne moom mooy Covid-19 bii mi ngi lëmbee àdduna si yëpp mu am solo pour ñëpp xam ne lu am la am na ba tax na la ñuy wax naka jekk mooy bul loru waaye bul nangoo lore li nga bëggal sa bopp ci mucc na nga ko bëggal sa morom ci mucc bu ko defee ñun ñëpp ñu ànd mucc mbir la moo xam ne nag lañ ci wax dëgg-dëgg mooy jëfe ndigal yi bàyyi tere yi mi ngi war a jógee ko ci ñi nga xam ne seen xam-xam màcc na ci wàllu faj moom mooy docteur yi nee nañu di raxasu waxtu bu nekk nee nañu moytu mbooloo yi daje dañ koy joxante foofa gis nga doomu jàngoro bi nekkul luy dox nit ñee koy toxal mu jógee ci nit dem ci nit kon loolu moo tax ñuy wax ne nañu moytu ndaje bi ak ndaje bu mu mënti doon dañuy wax ne daw bëri ci kat ci njàmbaar la bokk kon nañu góorgóorlu nañuy raxas suñuy loxo nañuy moytu daje yi ngir yàlla ak yonent ba képp koo xam ne nag gis nga sa bopp lu mel ni socc wala saqat ak yu ni mel mën ngaa woo 1025 nombre boobu moom ngay woo ñu wax la loo xam ne daan aju na ci li lay dimbale incha allah rabbi yal nañ mucc de asalaamaaleykum wa rahmatulah